Hello, everyone, and thank you for listening to IFFGD's COVID-19 program. The information and resources shared during this podcast should not replace any medical care you are currently receiving, and it is important to always consult with your doctor or other healthcare provider before making decisions about your treatment. Today, we have the pleasure of speaking with Dr. Brennan Spiegel, who is a gastroenterologist and lead researcher at Cedars-Sinai. So, hello, Dr. Spiegel. Thank you again for joining us today. Can you tell us a little bit about some of the things that you do day to day?
Yeah, sure. Thanks for having me. I'm a gastroenterologist and also a researcher. I see general gastroenterology patients, and I have a particular interest in functional GI disorders, irritable bowel syndrome, dyspepsia, take care of people with heartburn, and so on. Yeah, that's what I do.
Awesome. Thank you. So, some of you probably didn't get a chance to listen to our first podcast that we actually did with Dr. Spiegel back in April, and that's okay. But in our first podcast, we learned a little bit about COVID-19 and when it was first labeled as a respiratory virus. And Dr. Spiegel actually helped us understand that there were some research out there that presented that COVID-19 could also affect the GI system. So today, Dr. Spiegel will help us gain a better understanding of how COVID-19 affects the GI system, as well as some of the developing research that is going on and being generated in the field today. So, Dr. Spiegel, can you first briefly explain the digestive system symptoms that are commonly associated with COVID-19 and how it might present in patients as far as their symptoms?
Sure. When the virus was first discovered and came out, it was really thought to be mainly a respiratory virus. And of course, it affects the lungs and it can cause pneumonia and cough and chest pain and so on. But what we've been learning is that the virus can enter the body not only through the lungs, but also through the gut. And it turns out the gut is a really important portal for this virus to get into the body. And when the virus gets into the gut, it can invade the gut and replicate within the gut. And there's even some concern that it might even be able to spread from there to other parts of the body, including the lung. So the gut may end up being a very important part of how this virus presents itself beyond the already known effects it has on the lungs. So the symptoms, most commonly from a GI standpoint, are diarrhea, which occur in about 20% of people with COVID-19, as best as we can tell right now. But there are certainly other symptoms. People can have nausea, rarely, not as commonly vomiting, but nausea, low appetite, of course, and mainly diarrhea. So that's how we're seeing it present so far.
Yeah, and do you know or do researchers know about how long these digestive symptoms can last for patients who may have already recovered from COVID-19?
Yeah, so we're learning that the digestive symptoms can sometimes linger for a while. Initially, the studies were showing that the diarrhea lasted, about 4 or 5 days and might go up to like 14 days. And that's the case for most people. But there are more reports of people that go on to have diarrhea for weeks. Even some people have described it for more than a month. So I don't yet know how common these people are, or this manifestation is. There's a term that's being called the long haul COVID. This is the form of COVID that doesn't seem to quite go away. It just takes a while to work itself out of the body. And in particular, when the gut is involved, it looks like COVID can last longer than when it's not involved. And that might be because the gut is such a long organ that has so much surface area on it that the virus can involve so much of that organ that it has a very large viral load. and it takes the body a while to clear that out. So it may clear out the virus from the lungs faster, but it'll still be in the intestinal tract. And we know that because if we check the stool for evidence of the virus, mainly the RNA, which is the genetic material of the virus, it can stay positive sometimes for weeks, even after the respiratory symptoms have cleared. Now, that doesn't mean, some people often ask, that the stool is infectious. And, that's something worth talking about because there have been some updates since we last spoke on that. When we last spoke, we talked about how, there's definitely the virus in the stool, and in about 50% of people. But, that doesn't mean it's infectious. Now we do have one case report that the CDC has posted on their website of where there was evidence of infectious virus detected in the stool. So what that means is that it is possible that infectious virus could pass through the stool. I don't think that means we're spreading it through food or anything, but the worry is if you go to the bathroom and flush the toilet, could it sort of aerosolize into the room a little bit and potentially be breathed in? And some people have been worried about that in the last month or so as well.
Yeah. And in part of that, some patients have also been commenting on the last video that we did, and some of the comments and questions and concerns that we saw kind of be repeated through the comments was that many patients received a nasal test that came back negative. And we were wondering if you could answer how patients should go about if they received a negative test, but they are showing symptoms and signs that are related to the GI tract.
Right. So we know that the nasal pharyngeal swab, the throat nose swab, is pretty good early on in the course of COVID. So if somebody's been infected recently, even if they're asymptomatic still, that test can be pretty good at detecting the virus if it's done properly. But we also know that the accuracy of that test starts to fall off as people go a little bit farther into their illness. And that's about the time, about 2 weeks in is when that swab starts to be pretty inaccurate. And around then, the stool tends to be more positive. Now, part of the problem in this discussion is we still don't have widely available stool testing. And a lot of, I'm not aware of any insurance companies supporting that or really a lot of labs even doing that. I'm aware of some. But in the research that's been done, we know that the stool can stay positive. It's not positive initially, but it can turn positive a couple weeks in. Sometimes it's positive right off the bat. Other times it takes a few weeks before it turns positive and then stays positive, like I said before, sometimes for weeks at a time. So for people who are wondering, do I have COVID? I think the first thing is to think about what symptoms you're experiencing. Just having diarrhea without anything else could be lots of things. That could be anything from irritable bowel syndrome to you ate something bad, to stress, where some people think that there's a relationship. It could be anything. It doesn't mean you have COVID-19. But if you have a fever and diarrhea, that's certainly worth looking at. Or if suddenly you've lost your sense of smell and lost your sense of taste, in addition to diarrhea, that's quite specific for COVID-19 and definitely is worth looking into.
Yeah, and I think you touched on a really good point there for patients to understand is to make sure we're differentiating those symptoms and making sure also that some of the symptoms that may show or present itself are some of those also associated with COVID. Do you see those on the CDC guidelines and things of that nature?
Yeah, that's been an update since we last spoke, is the CDC now formally recognizes that diarrhea is part of COVID-19. So that's been a real advance, I think, for those of us in GI, that diarrhea is now is accepted by the FDA as a formal symptom of COVID-19.
Yeah, and do researchers actually know if there's different strands of this virus? Like in particular, would there be just because people may have GI symptoms but not have respiratory symptoms? Do researchers know if there's a difference between those two, or is it just depending on the person and what symptoms may present itself?
Yeah, so it gets to this question of how does the virus enter the body, and we know that it can get into saliva, and when we swallow saliva, it will go down into the stomach and then potentially into the intestines. It has to get through the acid layer in the stomach first, or it might get inactivated there. So it kind of depends on which way it goes. For some people, it may not even work its way into the lungs at all. Um, Although for most it's going to, and they're going to have a cough or shortness of breath or chest pain or pneumonia. Um, but we're learning now more and more that maybe some people actually seem pretty asymptomatic, but then they end up having some loose stool and a fever and say, "Uh-oh, is that COVID-19?" But then they might end up developing a cough later on. So we're still really learning, and it seems like there's different patterns that it can present in a different order between the lungs and the gut. It's rare that the lungs are not involved at all, though. They're usually involved in people who also have GI symptoms.
Awesome. Yeah. And can you touch on any other recent updates that we may not have spoke about in our first podcast that you believe will be very informative for patients who live with gastrointestinal disorders?
Yeah, I mean, I think the important thing is pretty obvious, which is not new. For all of us, basic hand washing, socially distancing, wearing masks is really vital, no matter what. There has been some research in terms of the gut now lately suggesting that maybe, as I said before, there's this, it's called the gut-lung axis, where maybe the gut can affect the lungs. And so it turns out that there's some research, and this is a little bit older research, that with this MERS coronavirus, you may have heard of the MERS, that was an older one, Middle Eastern Respiratory Syndrome coronavirus, where they put it in the intestines of mice. And then they ended up finding that it worked its way to the lungs of the mice. And they did this very careful, analysis. And so the question was, how did it get into the lungs from the gut? And some are worried that, especially in people who have changes in their microbiota. So we all, of course, have bacteria in our colons and some in the small bowel, but generally in the colons. And if there's been low diversity, in other words, normally you want like a whole lush garden down in your colon in health. But if there isn't much of a diversity of the bacteria in the colon, it's possible that the coronaviruses, can kind of get an upper sort of I guess, an advantage and work their way into the intestinal lining more easily. And as a result, make sort of, we like to call it a leaky gut, where then the toxins from the bacteria might actually leak into the body and work their way around the body, including the bacteria or the virus itself can get into the body, leading to serious symptoms. So this is still being looked at. I don't know that it has any immediate applicability for your listeners, other than just to know that it's always good to eat a healthy diet, to eat the usual kind of good sense diet with healthy combination of vegetables and fruits and the sorts of things that promote a healthy microbiota over time. You hear a lot of this with certain types of diets. This is one way to help generally protect your gut from infections, not just COVID-19, but other forms of gastrointestinal infections.
Yeah, I thank you for putting or adding that in there, ways to protect your gut, because I think that's so important. When you hear the new information, it's automatically, I think a lot of people will wonder, okay, well, what can I do to prevent it? So thank you for touching on that. Um, and also, the last time that we spoke, you mentioned that your lab would be launching a survey to compare the prevalence and incidence of IBS before and after this pandemic. So we were wondering, where are you with this survey, and also how might patients be able to participate?
Yeah, it's a great question. We've just finished the survey, have about 100,000 people who completed it. So I'm sorry that it's actually all over at the moment. We do plan to repeat the survey at intervals in the future so that we can monitor, the prevalence of different GI symptoms over time. We've done this in the past, and we did it between May and June of this year. So we'll be looking at the data and learning more about what symptoms people are experiencing. We also asked people if they had been tested positive for coronavirus, and we had actually a number of people who tested positive. In fact, more than we might have expected. So that's something we're looking at, and whether those people have what kind of GI symptoms they may have. So we'll hopefully be learning more and releasing more of that information as we go along.
Yeah, I think doing studies like this, especially during this unprecedented time, I think it's really, really cool just to be able to do the research now so that maybe in the future, should this ever happen, I know that most of us hope that we don't have to face a pandemic like this for years, but should this happen again, doctors and patients will have a little bit more information to kind of help us get through certain situations like the ones that we're going through today.
Right, right, yeah.
Yeah. So, or do you have any other advice that you might want to give the patients today?
No, I think, as I said before, um, we can do certain things to help protect ourselves. Eating a healthy, balanced diet is an obvious one, and it's easy to say that. It's harder to do that. If you really are interested, find a really good nutritionist and really learn and study what that involves. It's really there's a science to it, and I as a gastroenterologist really don't fully appreciate all of that, and it's amazing how much I learn when I talk to my own nutritionist that I work with. So that's an easy place to start for general good health, gut health in particular. Some people wonder, should I take probiotics right now? I would say no. The data on probiotics is very scant and not very strong. It's not clear what probiotic you should take or whether it's really going to protect you in any way against COVID-19. So, I wouldn't judge somebody for using probiotics, but I would just suggest I don't have clear evidence that it's helping. And we're learning more and more that, some of probiotics are rather expensive and may not provide a lot of benefit for something like this. So, that's something just to bear in mind, but everyone makes their own decisions about that. So these are just some things I'm thinking about. Vitamin D. This is another thing we might have talked about last time, where a lot of people are spending time indoors a lot longer than they might have normally because they've been quarantined or staying at home and maybe not getting as much sunlight as they would have. So, go out, get sunlight, obviously socially distanced, and if necessary, supplement with vitamin D. Always a good idea to think about that, talk to your doctor about that, because that can help with immune health also. So these are some general good practices to think about during this time.
Yeah, thank you so much for that advice. And thank you to everyone who tuned in to today's COVID-19 program. And as always, many thanks to Dr. Spiegel for talking with us about COVID-19 and GI symptoms, as well as updates that researchers have found. We are very grateful for you sharing your unique insights on this topic, and we wish you the best of luck in as you continue to conduct more research in the field. So thank you, Dr. Spiegel.
Thank you very much for having me.